Good afternoon, everybody, and thank you for the introduction. I'm an urban planner, not a healthcare or academic or practitioner, and I'm also a housing scholar. So in my work, I think about how housing and neighborhood character and quality are social determinants of health. I also study disasters. And so when I think about exposure notification, I think about the neighborhood and city context of these health and technology interventions. Next slide. So you've already heard about California Notify and how they, the designers employed a human-centered, inclusive design process. In fact, you have incredibly talented designers like Doctors Camille Nebaker and Elia Arnoff Spencer from the design lab where I direct, who worked with community and user groups to design California Notify. But this was done very quickly and in a short period of time, less than a year, right, that we heard. What this tells me is that in order to improve the success of implementing exposure notifications across diverse and hard to reach populations, it requires the already established trusting relationships. This is something that the previous speaker already mentioned, that these established trusting relationships can't be built in 6 months, right, when we come up with a new intervention or application. And this is where the challenge lies for greater adoption. Our public investments in developing civic and local infrastructure is needed that is needed to be activated during a disaster, such as a pandemic, have declined significantly. Both federal and state dollars in terms of investing in community-based organizations have declined significantly in the last few decades. In California, we got rid of 400 redevelopment agencies under the last governor. And these agencies work to address blight and the lack of affordable housing in our communities. So that's just one example. There are many, many more examples of disinvestment in communities. And having these community-based organizations, what I call the community quarterback here, that's involved in this inclusive design process that has already been talked about, is critically important. These locally based institutions that are physically located in communities can connect stakeholders. What those arrows show actually are where stakeholders are included in the inclusive design process. Somehow the stakeholder words got taken out of this slide. But these community-based organizations connect stakeholders, they build community capacity, and they bring in resources. These quarterbacks work tirelessly to empower the community and offer them control over their future and control in terms of whether or not they will adopt these new types of interventions. So next slide. Thinking about a systems approach here, others have talked about this, but I wanted to show this diagram to show that there are multiple levels that we need to be addressing, right? Not just the individual level, that design and interventions work across these multiple layers and multiple levels and within a system. And so thinking about this holistically is important. Next slide. So I'm going to talk about 2 case studies of community-based organizations that have created that civic infrastructure to respond very quickly to the COVID pandemic. And maybe I'll just have time to talk about one of them. So why don't I skip through the first case study? So next slide, next slide. This one here. This is a neighborhood in Chapel Hill, North Carolina, the North Side neighborhood. And the Marion Jackson Cheek Center that I work with pretty closely. It's a historic African-American community, and over the last decade or so, this community has been threatened with gentrification, developers coming in to redevelop homes and rent them out to students, thereby displacing long-term residents. And so the Jackson Center came in to help them to think about preserving their history, as well as building quality affordable housing and preserving quality affordable housing. And they dedicated themselves to for 10 years to helping this community. And they built very strong relationships with all of the community members. They actually go door to door and talk to residents all the time. And so when COVID hit, they activated these networks, these resources from the Jackson Center very quickly. They delivered food and care and even entertainment to the elderly who were feeling socially isolated. Right? They would walk the sidewalks and sing to them, and people would come out on their porch. And when the vaccine was available, they created an outdoor clinic to administer the vaccine so that the elderly didn't have to leave their neighborhood. Right? It's not just the Jackson Center, but they worked with the credit union, the university, as well as the local government to support this community. And so you can see there that this is an example of how this community quarterback, the Jackson Center, could be activated very quickly because they were a trusted organization already working in this community. Next. And so when we think about the context for successful design and implementation, we need to be thinking about working with these community-based organizations. And first, I think building the infrastructure and funding so that we have these community-based organizations. But we also have to think long-term, that these organizations should be in the community long-term. They should be place-based, they should be located there. They should have an abundance-based perspective, meaning that all community members are involved in shaping their future. And to think about holistic initiatives, so not just this one intervention, but how other interventions, or to take a holistic perspective about interventions. I already mentioned the community quarterback, which is very important, and then providing and building community empowerment and control over their own destinies is important. And then investments in human, social, and financial capital can really help for creating these systemic changes that then can make implementing exposure notifications possible. Thank you.